I'm Rolf Rosenkrantz, and I'm in Washington, D.C. with Anastasia Thatcher from Accenture Development Partnerships. You're the global health lead there.
I am.
And we're talking today about best buys in global health. So how do you approach this issue of what is a sound investment in global health?
Well, I think we really need to be moving more towards thinking about a market for development outcomes. I think largely we think about dollars in equals impact out. Increasingly, I think we understand that there's pivotal investments, let's say around capacity building, maybe leveraging technology that can help improve the efficiency and effectiveness of a whole range of other investments. And so I would say that some of these best buys around investing in health workforce, investing in workforce management tools and systems, as well as leveraging the power of mobile. Even though that's maybe becoming cliched, I think there's still quite a bit of room for growth in terms of investing in mHealth. So I think there's, on one hand, companies that still are thinking about doing good and doing well, having maybe a more philanthropic approach. And then there's some organizations that have started to really integrate the way that they invest in community development and global health specifically into their core business. So perhaps a couple examples there. When you look at a company that is thinking about how they're going to reach the next set of consumers, right? So many pharmaceutical companies are in emerging markets or in developing countries, but they're just accessing that tip of the economic pyramid, the affluent class, the upper middle class. But now they're thinking about there's a whole group of patients, consumers that have unmet need and actually are growing in economic power. And how are pharmaceutical companies going to invest with others to build the capabilities of supply chain, to build the capability of providers, of pharmacists, and even of patients themselves to understand the products and services that are going to be important to them? Perhaps I'll share an example of Novartis. They have a program you may have heard about, Arogya Parivar in India. Are you familiar with Arogya Parivar? It's a way of empowering local people in the villages where they live to become health educators and help to increase health-seeking behavior and demand for needed products and services at the base of the pyramid. And to make that all work, Novartis also invests in different packaging design, invests in a different product line so that this is more affordable and relevant to consumers at the base of the pyramid. And what's interesting is that this is a profitable business. They've actually now invested to a certain period of time and have been able to take it forward and are thinking now about scale. Scale within India, scale within East Africa, scale within Southeast Asia. So that's perhaps one example of a way a company is integrated best buys in healthcare, investing in a local solution, thinking long term in a way that is relevant to their core business success as a company.